Hello everyone, and today I'm discussing a very complex topic called as hypospadias, and I'll try to simplify it as possible. So if this is a penis, majority of us pass urine from the tip of the penis. Occasionally some children are born, in fact 1 in 150, and the incidence is increasing, where rather than passing urine from the tip, they pass urine from here, here or here. This is the scrotum. So this is the severity of hypospadias. So what is the basic pathology is the urine tube is not formed until the tube. The tube is shallow here. It does not have the outer wall, and hence the child passes urine from here. Usually when the child is born, the doctors tell the parents, and then everyone Googles about it, reads about it, and then starts getting worried. So hypospadias is a treatable disease. It's a cosmetic surgery. There are 2 or 3 myths about it. Some people say don't operate in childhood. Some people say operate in adulthood. But it's best, according to us, being operated in the age group of 3 or 2 years, because children don't have a memory at that time. If you start doing a surgery a little later, they remember the experience. Sometimes it cannot be very nice. And if you operate in a young age, the glans or the penis is very small, so there is no emergency. This is a cosmetic surgery. The second question that people ask is, will it affect the sexual life? Technically, no. This is hypospadias. If it is not severe, he'll still be able to pass semen from the tip of the penis. So the surgery should not be done so that the child has a better sexual life. You should parent children himself, because that all depends on also the number of sperms which will be produced. So all these things only time will tell. So why repair a hypospadias? Hypospadias is to be repaired because when children go to pass urine in a public urinal, you tend to look in on the other side and you see someone is passing urine from tip and his urine is coming from here. So it's a cosmetic surgery. It is important to advance the tip to the urine tip to the penis. Occasionally there is also severe curvature in the penis. So this is called as chordae. And the chordae worsens if the whole of the penis is much more before. So yes, if your child has a chordae, a bent penis and a hypospadias, he will have troubles having sex when he becomes an adult. So in these conditions, we make the penis straight and also bring the urine passage to the tip. There are various surgeries, about 200 named and unnamed surgeries, but now we have simplified the techniques of hypospadias and we tend to do everything in a one stage. The pathology in the hypospadias is there is no passage of urine or the wall which is there. So we have to create everything new. Sometimes using the skin of the prepuce, sometimes using a small part from the inner part of the cheek. The success rate of hypospadias in the best hand in a single stage or a 2 stage is about 70 to 80%. 20% chance they can have a fistula formation, the sutures may give away, or partially the sutures may give away. It's because of the healing process. A doctor's job is to bring things together. Whether it heals, only time will say. So don't get disheartened if someone tells you that your child needs a 2-stage surgery or your child needs a 3rd surgery. I understand, I'm a father of a child and I feel for everyone, but sometimes it needs to be done to make the child all right. In our unit, we have simplified the management of hypospadias. We didn't do everything in one stage. Even in severe chordae, we can repair everything in one stage. An important message which is also reached the community is that if you are born with a hypospadias, do not undergo a circumcision. So if your child has hypospadias, don't worry, don't read too much. Come to an expert, understand things, understand the pathology, and then we will give you the various surgical treatment and options depending on the severity of hypospadias. Remember, your child is like our child, and whatever is the best should be done. If you have any doubts, seek help to me on the email, WhatsApp or the YouTube channel. Looking forward to making children better in this world along with all my colleagues who practice hypospadiology. Thank you so much.